Hi, my name is Dan Hammer, and we're here in Chicago for the ITU World Triathlon World Championship. While the venue is magnificent, the weather is less than ideal. For September, it's unusually cold and blustery, but that won't stop these world-class athletes from competing. And we have the distinct honor of interviewing Dr. James Oury, a world champion in the 75-plus age category. I'm here with Dr. James Oury at the ITU World Championship Triathlon and Sprint Triathlon. And Dr. Oury, you're going to be in what event?
I'll be in the Olympic event, which is twice as long as a sprint. That consists of almost a mile swim, and then 25-mile bike, and then 10K run.
Okay, that's pretty intensive.
It gets your attention.
All right, great. So, Dr. Oury, I know that you've been using what we call nitric oxide therapy to help you with your training program. Can you tell me how that's benefited you?
Well, the most immediate benefit I noticed was that I was mentally more alert late in the day, and then when I would do workouts or do an event like this, the recovery time is shortened considerably. So that, as an event that I just did about a week ago, the next morning I could have gone back and done the event again.
I find that really amazing because since you've been using nitric oxide therapy, if you did an event 1 week ago, that event was the Ironman, if I remember correctly.
Correct. It was they call it the half Ironman World Championship, and it was a 70.3 mile total for the swim, bike, and run. And the recovery time for me after that kind of an event, which includes a half marathon, would usually be about 2 or 3 weeks.
Okay. And so now we're just a week away, or a week from that event here in Chicago at the ITU World Championship Triathlon, and you're ready to go.
I feel like it. Yeah. Well, we came back, did some swimming this week, did some biking after we got back from the World Championship Ironman, and I felt fine.
Great. Now, I know that you've tried other nitric oxide supplements, and you're using ProArginine Plus from Synergy Worldwide. Can you tell us why that supplement, or at least how you feel that supplement is better than anything that you've used before?
Well, I just noticed the effect more sooner, and it lasts longer. The other products I've tried either don't have a noticeable effect, and this did, as far as I was concerned, in terms of my recovery time.
Okay, so you noticed that from a mental alertness standpoint it helped you,
right.
In your event it helped you, but most importantly it speeds the recovery process because you're getting better circulation, more oxygen, more delivery of oxygen and nutrients, better removal of waste products so your body can recover faster.
I think that's a good summary of what that does, yes.
Okay, great. So we want to wish you the best today. What age category are you in?
I'm in the 75 plus. So that's the oldest age group, and I think one of the interesting things for me has been that the use of this product has really given me new energy to handle the lengths that we go to in both the Olympic distance and the Ironman distance.
And I find it also interesting, just before we interviewed you, we saw your brother Bob take off on the sprint event for his age category, and then your son Jeremy was about a half an hour earlier. He was in his sprint event. So you have a family of triathletes.
Fortunately, yeah. The boys blame me for most of this, but I started doing triathlons 30 years ago, and as they grew up, and as Bob, of course, any sport that I'm involved in, Bob wants to be involved in, and with the idea of beating me. So it's very friendly competition, and the kids kind of pick up on that.
Great. And one last thing before we go, I want people to understand that this is Dr. James Oury. So, Dr. Oury, could you give people a little bit of background in terms of why you're a doctor and what's your profession?
Sure. My background is as a cardiac surgeon, and I have been a cardiac surgeon for 40 years. So early on after medical school, I decided that surgery was what I wanted to do, and as I went through the residency, I to focus down on cardiac surgery.
Okay. And from your standpoint as a cardiac surgeon, how important would nitric oxide therapy be to prevent people from having to see you?
I think it'd be terrifically important. I saw lots of examples of people whose coronary arteries had aged prematurely, particularly smokers, and the inflammatory effect that you see is something that I think that this particular addition, the nitric oxide, we have used that in kids in surgery to stop the inflammatory response in the lung arteries and veins, and I think it was pretty obvious that you could see at surgery who were the smokers and who were the non-smokers, and I believe this drug will have a nitric oxide will have a profound effect on that.
Great. Well, I appreciate your time.
Sure.
Good luck in your event.
Thank you.
All right.
Thanks.
To learn how nitric oxide therapy can empower you to improve athletic performance and recovery, contact Dan Hammer at 1-800-966-3012 or email him, dan@agingnomore.com. We're helping athletes experience as much as a 15% increase in their athletic performance with faster recovery from their training events. If this interests you, then please contact Dan Hammer.